Let me begin with the small statistics. In the last year 2020, the number of Indian females suffering from cancer was about 7,12,758. Most of these cancers happen in postmenopausal women. However, some cancers did happen before menopause also. Now, whenever I talk about cancer, I always remember what my friend says, what my friend who is a cancer specialist says. She says that while other diseases while other conditions like high blood pressure or diabetes can only be controlled, it is only cancer which can be cured. Now that's such a positive statement to begin our talk today with. But how do we do this? By detecting cancer early. And how do we do that? By knowing about the warning signals that the body gives for cancer, and by doing preventive health checkups. Today, I, Dr. Sudeshna Ray, will talk about the 10 symptoms or signs that can serve as a warning signal for cancer. 1. Abnormal vaginal bleeding. Now, 90% of the uterine cancers will present in some form of irregular bleeding or some form of abnormal bleeding. Before menopause, most of these abnormalities in the bleeding, whether it is heavy or irregular, they can be explained by hormonal imbalances. However, they can also be precancerous or cancer. So, if you have persistent bleeding problems before menopause, please go and see your doctor. Now, this changes after menopause. After menopause, even if you see the first few drops of blood or a little bit of heavy bleeding, please do not ignore it. Immediately seek medical attention and rule out a cancer with some tests in form of sonography and blood tests. 2. Unexplained weight loss. Now, weight loss is usually a very welcome sign, provided you have an explanation for it. Like you have changed your diet, you have increased your exercising habits, or you're putting an effort towards losing your weight. But if you have lost about 4 to 5 kgs very rapidly without an explanation for it, then please go and talk to your doctor. Please seek medical attention. 3. Foul smelling or blood mixed vaginal discharge. Now, this is usually a sign of infection, but sometimes it can also be a sign of cervical, vaginal, or uterine cancer. 4. Constant tiredness. Now, fatigue after a long day or a long week is normal, but that should recover with adequate rest. If you are feeling very fatigued constantly throughout the last 15 days, and that is not recovering with rest, and which is affecting your work efficiency or making you feel disrupted in your work activities, then please see your doctor. 5. Loss of appetite or feeling full all the time. This can be a sign of ovarian cancer or any other cancer not related to the reproductive system. Pelvic pain or pain in the abdomen. Now, constant nagging pain, which can be in form of cramps or a dull pain or in form of a bloating or pressure, can be an indicator of an ovarian cancer or a uterine cancer. 7. A sudden change in your bowel habits or sudden change in your toilet habits. If you are normally having diarrhea, if you suddenly have constipation, or if you are usually constipated, you suddenly have episodes of diarrhea, and this is persistent for the next, say, about a week or 14 days, then it's a good idea to see your doctor, because this can also be a sign of a colon cancer. 8. Persistent indigestion or nausea. Now, this can be a very, very normal symptom for most of you, for a lot of you. But occasionally, very occasionally, this can be a sign of ovarian cancer or other cancers. So it's better that you seek medical advice if you feel that the problem is very persistent. Changes in your bathroom habits. If you start peeing very, very frequently without any burning, without any reason, if you are feeling a pressure of urinating constantly, if you're passing blood in the urine without any pain, these can occasionally be a sign of bladder cancer. So please seek medical advice. 10. Changes in your breasts. Now, most of the breast cancers that can be detected early are detected because you have felt a lump or you have seen some abnormalities in the breast while self-examination. There can be skin changes, there can be nipple changes, there can be a shape change, or you can feel a lump, which can be the first indication of a breast cancer. So if you feel any abnormality while self-examination of the breast, please get it checked by your doctor. Now, having one or more of these symptoms doesn't necessarily mean that you have cancer. But if they are constant, if they are bothering you, and if they are persistent for more than 2 weeks, then it's a good idea to see your doctor and get yourself checked. Please don't hesitate to write to me at drsudeshtacares@gmail.com for any further clarifications. Thank you.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.